Hello and good evening once again. It's good to be back. It's 8 p.m. UK time. So, as you know, it is definitely time to start our live event tonight. And another special guest with us. You can see her right here. It's Karen Schnaffer. I hope I said that correctly. Hi, Karen. How are you feeling tonight?
I'm good. Thank you very much, Caroline. Yeah.
Thank you so much, Karen, already for joining us tonight and for bringing this particular topic. This is definitely interesting, and I'm sure lots of you will have questions. So, as always, remember to type those in the chat section, and of course, Karen will answer them for you right after her presentation. And as you can see, Karen is actually the consultant embryologist and laboratory director at Urge IG IVF Life Group, which is located in the UK. And of course, Karen will be talking today about freezing your embryos, and she will be explaining how it all works and what it's all about. So, of course, don't hesitate, ask her some questions on that particular topic. And as I've mentioned, Taryn will start with her presentation. But before that, remember that we are here every single day to support you, to give you an opportunity to meet top fertility experts and fertility coaches, but also acupuncturists and anyone that will be able to help you and assist with your IVF attempts. And of course, as you know, our main topic for those Stronger Together events is successful IVF treatment after failed attempts. And we are going to be here for some time. So there are some more of those events coming up. And also, let me remind you that all those events have been brought to you thanks to our ambassadors and partners. And of course, you can see them right here on the screen. So huge thanks for their constant support. And as I've mentioned, we will start with the presentation that Karen has prepared for you. So, well, Karen, are you ready to begin with the presentation?
Yes, thank you. Yes. So good evening, everyone. Thank you for joining us. I'm going to introduce myself briefly. So I'm Karen Schnauffer, from Laboratory Director, and also the HFEA person responsible at Reproductive Health Group, which is based in Cheshire in England, right in the middle of Manchester and Liverpool. So this evening I'm going to be talking about embryo freezing and what it's all about. So what do we freeze? So we can freeze many stages of embryos. So I've got my pointer here. So various stages of embryos, but including eggs. So eggs can be frozen, just fertilized eggs, and then when the embryo starts dividing into 2, 4 cell, 8 cell, and the blastocyst stage. And the last picture you can see is a blastocyst, which is actually hatching out. So the survival rates are much better nowadays with a process called vitrification, and that works best with blastocyst stage. So I'm going to be concentrating my talk on blastocyst because that is the normal stage that embryos are at when we freeze them. So here are some beautiful blastocysts. I put this in. These are sort of beautiful textbook blastocysts. And what we're looking for when we're freezing blastocysts is this little structure in the middle, which is called the inner cell mass, surrounded by lots of little cells, which are called the trophectoderm. And then the whole embryo is full of a fluid cavity. The whole embryos are stretched up. Everything's nice and clear and very good quality. And there are various stages, various different types of quality, actually. I'm not going to go into the full detail of this, but there are sort of different levels, and there are different levels we can freeze and some poorer qualities that we can't. So these are examples of fully expanded, mature blastocysts. We do a grading based on the two structures that I mentioned earlier, but I'm not going to go into a lot of detail with that. But these are all different, quality blastocysts that would be suitable for freezing. Here's an example of a blastocyst that has moved on to the following stage where it's actually started to hatch out of the shell. You can see this faint little sort of cavity here, which is called the zona pellucida. And that is the shell that surrounds the egg and then the embryo throughout its development until it finds a weak point and hatches out. And that's when it would be ready to implant. Here we have an example of a fully hatched blastocyst. And you can see there's not got the shell surrounding it. You can see the structure I mentioned earlier called the inner cell mass, and then surrounded by these lovely even inner cell mass cells. So how do we freeze them? So I'm going to base the talk on the experience of what we do at Reproductive Health, but I do need to point out that there are various devices for freezing and different culture media, freezing media, but I'm going to concentrate on what we do. So this is one of the systems that we use. It's a straw called Rapid Eye. It's manufactured by one of the IVF companies. And it has an outer and an inner. So if you have a look at the photo in the middle, we've got this outer sheath and this inner sheath, and it's the inner sheath that the embryo sits on. I do apologize, that circle is supposed to be over the end to then link to this photo over here. This is what is at the end. And there's this tiny, tiny little hole. And the blastocyst is placed just inside the hole, so it's sort of suspended, and then the whole thing is then placed into the outer sheath, and then it goes to freezing. I'm going to go into more detail in a bit. So the whole kit would look like this. We have a sealer, because this straw is sealed at both ends, so it's completely secure. And then there's this box where the straws sit, submerged in liquid nitrogen, so that the straw is at the right temperature throughout that process once the embryos have been loaded. Here are some photos of the actual process. So I hope it's clear, but we have in the first photo the culture dish that has the different solutions in for freezing the blastocyst, and they go into each of the different solutions for a certain period of time, and then you move them to the next one and you wait for the period of time it needs to be in that solution. And then once it's gone through this process, which takes about 12 minutes, you then load the embryo up. In the second photo, you can see there's a little glass pipette, and the blastocyst is being placed into, and if we have a look at the last photo, it's being placed into that little hole in that little structure that fits into the outer sheath. So as soon as that's done, you have to place it into the outer straw, which has been submerged in liquid nitrogen. And then if we look at the next photo, we heat seal it. The bottom is already sealed, and then it is plunged straight into liquid nitrogen, and it's completely sealed and frozen. So we obviously need to label them. We have to make sure that we can identify them, and that is done by labels. So the labels used in freezing are wraparound labels, so they're completely secure, nothing can be scraped off, and they're also temperature resistant labels as well. And most freezing programs also use a lot of color coding, so it's very easy to, as you go into the vessel, instantly your first identifier would be a color, followed by your label, and then you would locate the appropriate straw for the appropriate person. A lot of systems nowadays use a barcode reader as well, so not only have you got the details printed on the label, you've also got this barcode to confirm the details on whatever system you're using. So where are they stored? So from us freezing them into the straw and placing them into a special container which contains liquid nitrogen, we then move them to the actual storage. And here's some examples of a storage vessel filled with liquid nitrogen. So what you can see here is actually the vapor from the liquid nitrogen, which is at the liquid nitrogen sits at 196 minus 196 degrees. So the embryos are suspended in time. So from them being frozen, they just stay. They don't do anything else now until they are thawed. And here's some examples. These are some straws like the ones I've described earlier, sitting in different coloured vises. So you'd have various colour identifiers, and the visi is the container the straw sits in. So you've then got another colour identifier, and then at the top of the straw there's also the patient's details, and most likely a barcode. So you've got all these checks in place to make sure that the right straws are removed from storage. So changes in sort of freezing programs since COVID. I haven't really sort of touched on this that much. I was expecting some questions, but in the UK, as a result of the COVID situation, our regulator, the HFEA, have actually changed the law on the storage period for freezing embryos, which is normally 10 years. And because they recognise that there will be an impact on people who maybe were about to start, or their storage periods were coming up to the end of their consented period, they have now extended this in certain circumstances for an additional 2 years, which means that patients are not under pressure to come back for treatment maybe when they're not ready, or, you know, I mean, everyone's very worried at the moment about staying safe. So it just gives a little bit more flexibility for patients under the current circumstances. I know there have been some sort of studies recently. There's one saying that although nobody knows yet the full impact of COVID-19 on embryos, it is possible that there may be an effect on the very early stages, maybe up to the first sort of 13, 14 days of embryo development. But it's still very, very early days, so we're not sure exactly what the true impact will be. So moving on now towards success rates. And I've put this slide up again based on the UK information. With freezing, a lot of people are probably quite concerned if they don't have a fresh transfer. They feel that maybe they're not giving themselves the best chance for whatever reason. Sometimes, you know, when you have your fertility treatment, you're actually not able to have the fresh transfer for whatever reason. It might be that, you know, the lining of the womb is not appropriate. It might be that the environment is not appropriate. It might be there's been some overstimulation and actually it's not safe to proceed. So the process would be that we freeze everything, and the patient then recovers and comes back at a future date to have her frozen embryos replaced. So this is taken from the UK regulator, the Human Fertilisation and Embryology Authority's most recent data. And this is showing you the birth rates for fresh and frozen. Excuse me. Going back to when it started in the UK, which is the HFEA started in the UK, which is 1991, when they started recording this information. And you can see the pregnancy rates back then were very low. Sorry, the birth rates were down around sort of 5 to 8%, and they've steadily got higher and higher and higher until we come up to 2017, which is the most latest data that we have from the HFEA. And the live birth rates are around sort of 22%. But what's interesting is if we have a look at the dotted line underneath, this is the frozen embryos. So this is the birth rates from frozen embryos. And as you can see, they did lag for many, many years behind the fresh. So that it was beneficial back then to have a fresh embryo transfer. And then we got to sort of, you know, towards around 2011, and onwards when the vitrification, which is the process I've described earlier, really kicked in and became the normal way of freezing embryos. And for the first time, we've seen that actually the frozen embryos now, for the period that has been presented, is actually higher than the fresh. So it's not to say that your chances are better if you have frozen embryos replaced. What this is demonstrating is that it isn't detrimental to have frozen embryo replacement. Your chances of pregnancy are not decreased if your embryos are frozen. And I just wanted to show our data. So what I've done here is I've pulled all our clinical pregnancies for frozen embryos going back to January 2016 until the latest ones from September 2020. And that's the 33.2%. So, this means this is over 33% of all patients who had a positive test then went on to have the presence of a fetal heart. And I haven't got the birth rates to do a comparison from that, but that's a good figure. And I seem to have got through this much quicker than I thought. I'm sorry. More time for questions, but thank you very much for listening. Caroline there?
Wonderful. Thank you so much for presenting this topic to us, of course, for explaining how it works. And well, you are very right. Now it will be time for our question. There are some of the questions ready, and I see that someone is also typing. So I just want to remind everyone that if you have any questions, just go ahead and type those in right now. Karen would be more than happy to help you out with this, I'm sure. And well, let's have a look, of course, at the very first question that we have received. And the question is, how long embryos freeze without defect?
Okay. So, as I mentioned, embryos are suspended in time, and there has been evidence where embryos have been frozen that have, thawed, that have been frozen for 50 years and there has been no effect. Now, I can't say that these were actually used in treatment, but it has been shown that freezing them in liquid nitrogen means they just stop. They don't change once they've been frozen. It's reassuring for long-term storage because some people are storing for many, many years.
And excellent. Thank you so much for that clarification to that one. And in the meantime, before we go with the next question, are you able to tell us? So, with everything that's going on with COVID-19 going on, do you see that more and more people are interested in freezing their embryos as well, like rather than going for the trash transfers as well?
No, I haven't seen that. Um, it seems to be pretty normal. People are coming through wanting treatment. One of the extras with treatment is good embryo quality and hopefully freezing. So there hasn't been a specific increase that I've noticed in patients wanting to freeze their embryos to then use at a later date specifically because of COVID. Maybe other colleagues have had that experience, but I haven't spoken to anyone who was presented with those concerns.
All right, understood. Of course. Thank you so much for answering that additional question from me as well. That was just something that I was thinking about and thought that might be interesting. Thank you so much for that
That's a good question.
clarification. And so, well, let's have a look at the next question that we have received. I have frozen eggs that I might use sometime in the future, and PGS would be good due to my age and PCOS, but it's illegal here. So I might want to ship them abroad. What are your thoughts about that?
Well, we do move embryos from country to country. It does depend what exactly you want the PGS for. Um, for the UK, if it was to do sex selection or something like that, that's illegal in this country. So you would have to look into where you wanted to move them to, in terms of what you would be allowed to have there. If your concern is actually moving them and it's that process of traveling, transferring them from one clinic to another, it's fairly routine nowadays. And even in the UK, you get people moving their embryos from clinic to clinic to clinic. You use specialist couriers, that have to have all the appropriate equipment, all the temperature monitoring. So I wouldn't have any concerns about that if you use an appropriate professional courier who specialise in moving embryos and gametes. But you do need to check where you're sending them, or you're thinking of having treatment, just to make sure that what it is you want to have there is legal.
And wonderful. Thank you so much once again for your question, indeed, and of course your answer to that one. And let's have a look at the next question. Pretty straightforward. How do you defrost an embryo?
So the thawing process, so for vitrification, we actually call it warming, is a little bit like the reverse of the process that I mentioned earlier, except the embryo goes into solutions for shorter periods of time and it's more solutions. So again, the whole process takes about sort of 12 to 16 minutes. But what is critical about the warming process is the initial step, from bringing it out of the liquid nitrogen and placing it into the first media. So that's an absolutely critical step, which has to take place within it's seconds from it being moved out of the liquid nitrogen and placed into that first dish that contains the culture media. And then after that, it just carries on, depending on what protocol you're using, various minutes in various solutions. And then at the end of it, you can see whether or not the embryo has survived. And then you normally leave it for sort of maybe 1 or 2 hours to let it fully recover before you would consider transferring that back into a patient.
And excellent. Thank you so much once more for the explanation to that one as well. And next question is also ready. For women who is 41, how many embryos blastocysts should one freeze to ensure the success of for pregnancy? Because I am not yet ready to have a baby.
Okay, so I'm assuming you are 41 at the moment. That is an interesting question. So it isn't a straight answer with this one. There isn't a certain number of blastocysts. Oh, thank you, Eve. There isn't a certain number of blastocysts that you require to achieve a successful pregnancy. I did mention a lot to do with the quality, and unfortunately, as women get older, we, our egg quality decreases, our chances of pregnancy decreases. But you do get some ladies who, are in their 40s who are not physiologically 40, and actually respond quite well. So really, you would need to have your all your tests and find out what your chances are of, stimulating. Get a rough idea of how many eggs would be expected to get. There's also the sperm side of things, so you need to see what the sperm quality is like. Have to have a look at the whole picture. But age is a factor, and I'm sure if you spoke to someone, they would possibly be suggesting that this is something, if you're interested in, that you should perhaps act fairly soon if you're 41 already. It's quite unfair for women, but that's unfortunately the reality of it.
All right, thank you so much. That is true. There's nothing we can do about it and change it, so we just need to deal with it, I'm afraid. Thank you so much for explaining this one as well, of course. And next question is up, but of course, there is also a thank you from Eve for you.
Yeah,
And
thank
thank you
you.
so much.
Good luck.
So, yeah, of course, fingers crossed, indeed. Does a high BMI have an effect on IVF success with frozen embryos?
The BMI is more to do with the stimulation to actually create the embryos in the first place. However, it is beneficial not to have a raised or too raised a BMI for treatment anyway, just because of the risks to with regards to the pregnancy anyway. Um, that's more something that a consultant would discuss with you. But yes, there are links. But I think that's something, if you wanted more details, I could pass you on to one of my colleagues who could provide more details about that question for you.
All right, again, wonderful. Thank you so much for this. And well, there is another thank you from
Oh.
Emma. All right, and let's have a look. Next question is up. For how much time COVID virus can stay in L? And I'm sure, sorry, not.
Liquid nitrogen, I
Yeah.
think.
Okay. Thank you. Yeah.
Interesting. I don't know the answer to that question. And as a result of us not knowing about viruses and how long they can be, active in liquid nitrogen anyway, most centres that I've worked in anyway, we would use a closed straw. So the system for freezing would be closed, so it's sealed at both ends, so nothing can get in. And this is a good example of why having a sealed system is ideal, so that you're not exposing anything. So really, even if there is a COVID virus in the liquid nitrogen tank, it wouldn't be able to get anywhere near any embryos. And then the processes we have in place in terms of how we handle straws containing embryos, either putting them in liquid nitrogen or removing them from liquid nitrogen, means that there is no cross-contamination because of the processes we have in place to ensure that doesn't happen.
All right. Once more. Thank you so much for, well, that interesting question indeed, and of course for your answer. Next question is, so do the chances of pregnancy with frozen embers for women over 40 and women under 35 stay the same? I would like to know, would freezing impact the embryo quality for older women, knowing that they are not the best?
That's a very good question. So pregnancy rates for ladies over 40 are less than ladies under 35. So you do see, so under 35 is considered, the sort of the group of patients who have the best chance of pregnancy. In the UK, the regulator splits that, all the different age groups. So you've got the under 35s, and then you've got the 35 and 36s, and then you have the 37 to 39s or the 40s, and then you have the over 40s. And it's because the chance of pregnancy does decline quite steeply once you get over 40. So I think just in general, the chance of pregnancy using fresh or frozen embryos would be less. That is well known. The good part of this question is the fact that you've recognised that there would be a possibility of a poorer quality embryo because the eggs are older. The only thing I can say to do with that would be that only embryos that are of a certain quality are suitable to be frozen. So there's also a chance that the embryos may not be suitable for freezing in the first place, and those that were suitable for freezing would be of a good quality. what's happening within them from a chromosomal point of view is unknown. But if they've met all the criteria to be frozen, then from experience, there is a good chance of pregnancy, but it's not the same chance as under 35 or under 40. So I hope I've answered that question for you.
Thank you for the clarification. Actually, there is a follow-up, okay? So let me just show you straight away, right here. I have frozen my eggs at 40, and I am wondering if the quality will stay the same after thawing. I heard that older eggs usually are very fragile.
Yes, that is possible. Yes. So frozen egg freezing is not as stable as embryo freezing anyway. But it's getting better and better. But compared to embryos, it's not. But that is a risk, and we do see that working in the laboratory, that the eggs that come from older ladies are not the same quality as the younger groups that we were describing. So I don't know how many eggs you had. So if you were going through for treatment, they would thaw quite a few of your eggs, depending on the program. And I have no other details apart from what you've put in your question. So depending on your circumstances, they most likely would take quite a few eggs out if you have them. Oh, 16. Okay. So they may decide that they take 8 out and they work on 8. Or they may decide, depending on your circumstances, that it's less or more than that. And what they would do is fertilize them and grow them and just basically take it from there and see what the embryo quality is like.
And then once again, thank you so much for your question and of course for your recommendations, your advice, and of course there's a thanks from the patient for you right here. All right, next question is a bit of a longer one. So let's have a look. I have stage 4 endometriosis. We did simulation last month and currently preparing for frozen embryo transfer. Probably next week we will have a transfer. It will be a month since stimulation and 6 months since my laparoscopy where one tube was removed. Do you think my body has a good chance of pregnancy, and was the waiting between stimulation and transfer long enough?
Okay, this is definitely a question for a medical colleague, I'm afraid. I wouldn't be able to comment on that. I'm a scientist, not a medic. So I'm very happy to take that question away and we can respond to you directly. Is it Kayleen? Kayleen, if you'd like us to.
Yes, and of course, wonderful. Thank you so much. I will be able to forward this question to you and your
Okay.
team, and I'm sure you will be able to simply send this to the medical doctor that will be happy to answer this for you.
Yeah, that's
Okay?
no problem.
Wonderful.
Yeah.
Thank you so much, then, of course. And there's a thank you from the patient as well. So we will simply forward this. I have made a note of that as well. All right, and let's have a look at the next question that we have. So it's the eggs that would move in order to not have a sick child or many miscarriages. I just wanted to check that it's not too much freezing and unfreezing, so it might be better to stay here.
Right. So this is going back to the PGS question and moving them to another clinic because that PGS process was illegal in the country that Maria is in, which,
Yes.
correct, yeah. So to move embryos, they are not thawed, they are actually transferred frozen. So if your worry is that they would be thawed and then transferred and then frozen once they got to the center that you're transferring them to, that's not what happens. So they stay frozen the whole time. They're transferred in sort of a little bit of liquid nitrogen, but also the vapor, which is still very, very cold. It's sort of minus 190 degrees. So they never warm. I mentioned we call the thawing warming. So the unfreezing doesn't happen until you're ready to use them. But if you're now saying, I've just thought that the PGS of frozen embryos does involve unfreezing, but that's nothing to do with moving them to another centre. Yeah, it's moving. Oh, it's eggs. Sorry, there's a few questions coming through from Maria, I think, to update us.
Yes, it's
Yeah,
moving eggs, she has added. Yeah. Sorry, I'm just
right.
checking. No, nothing else at this point.
Okay. So if it's to do with actually moving embryos that have been frozen, and it's the process of the PGS, yes, they would have to be thawed, and then they would have to be left. If you think about how I described in one of my answers, the actual warming process, and you leave them for 1 or 2 hours to assess whether or not they are fully recovered and survive the freeze thawing process. Then you would proceed and do the PGS by removing some cells, and then you would have to refreeze. You're now saying it's moving eggs. So if you were moving your eggs, then you do the fertilization. So you'd thaw the eggs. You would then fertilize them and then grow them up, and anything suitable. Sorry, I'm just reading the new question.
Yes, this is a follow-up right here.
Oh, I see. Right. Okay. So the moving process will not change the whole process, apart from the fact that where you are now, you're not able to have PGS. So I'm assuming what you mean is that you would have your eggs and then you would thaw them and have ICSI and then not have any genetic testing, but you would have an embryo transfer from those warmed eggs. And you're right, that means there is one freezing process less. So that's the normal process for frozen eggs. You have your eggs, they've been frozen, you thaw them. You have to have the ICSI process if you're having frozen eggs. So you do the fertilization with ICSI, you then grow them up to day 5, and then the best embryo goes back, and any suitable blastocyst would be frozen. Whereas if you're having fresh eggs, then that initial freeze process doesn't occur. But you have put then thawed. So I'm assuming you mean thawed frozen eggs. That's what I'm assuming you mean. Which means the only extra freezing would be the fact that you're actually having the genetic testing, and you do have to freeze it after you've performed the genetic testing. You freeze it, you wait for the genetic result, and then you thaw them again. So I think that's what you mean, Maria.
All right. Excellent. Thank you so much, of course. And sorry, just want to check. Yeah, there is a thank you from Maria.
Oh, okay.
Yes. Okay.
Yay.
Thank you for that. Thank you for the explanation, of course, as well. And next question is up. Do M1 eggs usually survive thawing at the same rate as M2 eggs?
Right. We in the UK, the centres I've worked in and the centres I know don't freeze M1 eggs. So just to explain for people who may be not sure what this means. So a mature egg that has undergone all the maturation processes and is of a suitable maturity to fertilize is at the metaphase 2 stage, which is we call it an M2. And the stage before that, where it's still immature and unable to fertilize, would be the M1. So that's what this means. And we use this as a grading system when we're preparing eggs for ICSI. So we only inject M2 eggs because M1 eggs can't fertilize. But obviously there are places in the world that may freeze M1 eggs and then do oocyte maturation afterwards. And oocyte maturation is still one of those procedures that it's not routine. There are some centres that are still sort of trying to develop it, but it's not something that has really taken off as much as the other processes with frozen eggs. So it's not anything I've had any experience with. I do know some centres have studies or had studies that were looking at maturation processes, but I wouldn't be able to give you any information on that. I'm sorry, it's not an area that I've had any experience with.
All right, of course, that's totally understandable, but still, thank you so much for this answer to that question. And of course, there's the things from the patient as well. Okay, next question is up as well. Sorry, just a bit of a longer one as well. At the beginning, will you explain how you can have fresh embryos and how long they stay fresh? I'm 48 and I'm single. Will you recommend to use embryos better than to select or have egg donor and sperm donor? Can you choose the nationality of the donors of the embryo?
Okay, so you're 48 and you're thinking about embarking on IVF treatment using by fresh embryos. I think you mean using your eggs to create embryos and have those used as used in treatment. I'll just go along with that thought until you say otherwise. So 48 is right. So it's donor eggs. Is that right? You're looking at donor eggs. Oh, right. Okay. So I'm just a bit confused about the question one with where the embryos are coming from. So I'm assuming that's an egg donor, and this is it possible that they are not donor? Sorry, I don't know what. So is the first part of the question that you are your eggs? So you're not menstruating. So at 48, it's very unlikely that you would be able to use your own eggs for treatment. And it's not just a case of the fact that our egg quality declines as we get older. It's quite possible that we wouldn't even get any eggs, in a 48-year-old patient. So I think, again, I have to say I have no information apart from your age and there's no menstruation, that your options, if we keep it very simple, because I don't have any details, your options would be to have an egg donor. And as you said, you're single, then you would choose a sperm donor. You can get different nationalities of donors. Yes, they have. And again, that depends on the clinic and the country you're in on whether or not that is a simple process. I can't see why anyone would object to you choosing a donor of a different nationality. I can't see why that would be an issue, but that's something you would have to question with the centre that you go to.
All right, of course, thank you so much for that. And if you would like to get some more details, okay, I will send you a link in a minute, so you will be more than welcome to simply get in touch with the team and just simply provide them with more details. And I'm sure Karen and her team will be more than happy to help you out with some more details indeed as well. And of course, there's a thanks from Tanny. All right. Next, let's have a look at the next question that we do have right here. Do you think that different item and solution can affect in freezing and thawing embryos?
Yes, I do. I've used various solutions, but also various freezing systems. And by the system, I mean the straw that we actually place the embryo in. My choice would always be a frozen system. Again, so the embryo is in a completely sealed unit. Some systems are open, and although there haven't been any issues recorded with regards to the safety, that's not a device that I've always felt very comfortable with, but I know they work perfectly well. And some people believe the fact that there isn't an outer sheath means that the survival rates are higher. But survival rates now in a good freezing system is in the 90s anyway. So the percentage, I mean, the survival rates. I'm happy with that. But yes, we do specifically select the freeze media. The media is the solution that we want to use in a lab based on the evidence and the survival rates. And we move from one to another if something else comes along and the evidence is there that the survival rates and pregnancy rates, which again is what we want, are improved. So it's something that we're always looking into and improving in our laboratories.
Excellent. Thank you so much once more for that. And of course, there's a thank you so much, and I hope to meet you again from the patient for you.
Oh, yes, likewise. Thank you.
Wonderful. Thank you so much. Next question is right here. So, is the success rate when thawing embryos the same as when thawing eggs?
Good question. I mentioned earlier that eggs are not as stable as embryos. So no, they don't survive as much. I mentioned before when I answered one of the questions, I think it was your question actually, about if you had the 16 eggs, they may thaw 8. And that's not only to do with the fact that you want quite a few eggs to be able to fertilize them and create the embryos and then grow them up and have the choice. It's also because the eggs are not as stable. But as time's going on, the eggs are improving. The survival rates and pregnancy rates with the eggs are improving all the time, but are not as high as they are with blastocysts. Even though it's the same process that we use, we vitrify eggs and we vitrify embryos. It's just a few adaptations to the actual freezing process is slightly different because the eggs are not as stable. So that's a yes. Sorry.
All right. Thanks, Avalion, once more for explaining how it, of course, works. Next question is right here. If leftover embers after IVF, if I have leftover embers after IVF, do clinics usually charge per vial or one cost for all of them, regardless of how you want to group them?
Right, so this is referring to how the embryos are actually frozen in the device that I would have mentioned earlier. So that depends on the clinic. It's normally, I say normally, so from my experience, I can't answer for clinics around the world. If you do a freeze, it's a per cycle freeze. So you would have the charge based on if 1 or 10 embryos got frozen, but that might not be the case for some clinics. It might be per embryo, which actually maybe the cost varies depending on how many you have frozen. So it might be cheaper if you only have 1 frozen as opposed to 10, rather than 1 cost for the whole lot. So that really is perhaps if you're looking at clinics that you want to have treatment in, that's something you can ask them what their policy is. It's possible. Yeah.
All right. Thanks once more for explaining that one. Next question also is a straightforward question. Do you usually know the age of the donors of the embryo, and are they always real couples?
What do you mean, my real couples? You You do get told the age of the donor, or you can. In the UK, that is, there's certain bits of information that you can find out. But in the UK, embryo donors need to be 35 or under. Oh, if they're married. No, you get egg donors who are single women, married women, divorced women, all sorts of people put themselves forward to offer egg donation. They don't have to be in a couple. They also don't have to have, depending again what country you're from, but from my experience in the countries that I've worked in, they also don't need to have had children themselves.
All right. Thank you so much for the clarification, of course, as well to this question. And we have few questions left. We will be slowly finishing, but of course, if you have any questions, just go ahead and type those in the chat section. And of course, there's a thank you from Danny for you as well. Next question again, another interesting question. Do Ambrose from ICSI survive the thawing in a lower rate than Ambrose from IVF?
From my experience, no, there's no difference. The survival rates are roughly the same, and as I mentioned, a good freezing and thawing program in IVF centres should be in the 90s, and I haven't come across one being more susceptible to damage from the freeze thawing process than the other. So no, it doesn't appear. Oh, why?
Thank you so much. There's a follow-up, okay?
Right.
Right away. So why do frozen eggs should be fertilized only using ICSI after thawing? I hear that ICSI could damage the egg.
Yes. So the process of egg freezing means that the eggs that naturally surround the egg have to be removed, and the egg actually requires those cells to be able to fertilize. So for IVF treatment, the sperm makes its way, and there's lots of chemicals and chemical reactions as it works its way through all those cells to reach the egg. And without those cells being there, it can't fertilize. And the egg's survival is based on those cells being removed. So without the presence of those cells, you can't do IVF. So ICSI is your only option. In terms of damage to eggs, in the UK, damage is acceptable up to 10%, but in reality, it's more like between 5 and 10% of eggs can be damaged by the actual ICSI process. And just in case people don't know what ICSI is, that's where we take one sperm and we inject it into one egg using a very fine needle. So it's quite invasive. You are actually pushing a needle into the egg. But as I say, survival rates are normally between 5 and 10%. That can alter if the egg quality is poor, because we have touched on that. So poorer eggs may have a higher chance of damage.
And perfect. Once more, thank you for that. Of course, let's have a look. There are, as I've mentioned, there are like three questions left. So let me go ahead with the next one. Do you have frozen donor eggs? If not, do you buy them? Do you have a donor database?
No, we don't. So we have ladies who come to the centre because they wish to donate their eggs, but we don't have a donor bank. There are donor banks around the world. In the UK, the law makes it very difficult. So it's not something that can't be done, but it's also something that isn't routine. There aren't national or multiple donor banks in the UK. But there are companies, if you have a look on the internet, there are donor banks that can provide them, and they ship them throughout the world. And again, depending on what country they're shipping to, you'd have to look into, or the clinic you go to would give you advice on whether or not they would be able to accept those eggs. And that's the same for the UK. It doesn't mean we can't accept them. It's just a process where you have to, depending on where they're coming from, you have to do lots of checks and make applications to the regulator. But our centre does not have a donor database. But we do treat, we do have egg donors, and we do treat patients wanting to have treatment with donor eggs.
And wonderful, thank you so much. And there's a follow-up, so let me go straight to that one. So do you show photos of the donors and some details?
Photos are not allowed in the UK, so that's not possible. I know in America, some of the sperm donors, egg donors, you can get photos of them at various stages, when they were babies and toddlers and children. The information we can provide would be sort of hair color, skin color, eye color, if your hair's straight or curly, height, build, some details about their interests and their occupation. That's about all that we can provide to recipients in the UK. However, in the UK, once any child born from donation reaches 16, they're able to then be provided with further details about the donor. And then once they get to 18, they can actually make an application to the HFEA and find out who the donor is. They can get full details. So we don't have anonymous donation in the UK.
And wonderful, thank you so much for the clarification to that very important question indeed, and explaining, of course, how it works there. Okay, let's have a look at the next question. Why would you freeze eggs if they didn't turn into embryos?
Well, they do turn into embryos. So some people don't actually have any choice. There may be, a single woman who, there's lots of scenarios. There might be a single woman who actually hasn't got a partner and wants eggs to use in the future. It could be somebody who has found out that they need to have chemotherapy. So it might be a process where everything is very quick and they have to undergo the egg freeze before they start chemotherapy. So many centres in the UK and around the world may actually give patients the option of eggs or creating embryos. If you create embryos, then they also belong to the man, and if it's not a stable relationship or the relationship breaks down at a later stage, you're then maybe faced with not being able to use the embryos in treatment. So if the partner who's created the embryos decides in 5 years that actually doesn't want to have children, then you wouldn't be able to use those embryos. Whereas eggs, you could then fertilize them with the sperm of a new partner or a donor, and then have the possibility of using them. So that's why you would have frozen eggs instead of embryos. But normally when you're counselling a patient, you have that question with them. There's always the possibility that eggs might, under the circumstances, be a better option than embryos.
All right, again, thank you so much for that. And there's another question from the very same patient. When would you have ICSI over IVF?
Okay, so ICSI would be suggested if there was any male factor issues. So it could be low sperm count, it could be surgically retrieved sperm, maybe a sort of just poor, some of the parameters that we measure may not be ideal. So the IVF needs good quality sperm, and the difference between the two is very extreme. With IVF, you prepare the sperm, excuse me, and you're looking at a concentration of 100,000 sperm uh, per mil for each egg. And with ICSI, you basically need one good quality sperm for an egg. So the extremes are very different. So some people, the sperm just is not good enough, and it has to meet a certain criteria to be able to have a chance of fertilizing through IVF. It might also be people who have had failed IVF, so they've had failed fertilization following IVF treatment. We would then recommend they have ICSI because we know that the IVF hasn't worked. Also, if there's ever any indication that ICSI is the better option, you do tend to stick with the ICSI because once there's been that possible, issue maybe with the sperm sample, you do tend not to risk having IVF and then the chance of a failed fertilization. But again, this is on a case by case basis, and everything is looked at to see what is the best treatment for the patients.
All right, thank you so much. And there is a follow-up, okay? I just want you to see straight away. I'm a single woman going through IVF, and it was thought a better rate of pregnancy for IVF than ICSI.
Okay, so that's probably as a single woman, you'd be having donor sperm, so you haven't actually got any specific. I'm assuming you're having treatment because you're a single woman without a partner, so you need to go through this treatment to give you. There we go. Yes, that's correct. So there are no underlying fertility issues apart from you're single and you're not with a partner who would provide sperm. So in that case, IVF would be the option that we choose for you. If you came through and you had IVF and it was a failed fertilization, or there's a small possibility that the donor sperm may not be of a suitable quality on the day, and therefore they would convert it to ICSI again to rule out a higher chance of failed fertilization. But a single woman coming through for IVF using donor sperm, the first option that we would offer would be IVF rather than ICSI. Success rates with IVF under these circumstances are very, very good.
All right, excellent. Thank you so much. And of course, there's the thanks from the patient. Okay, let's have a look. Next question is up. So, how soon after a failed implant can you try again with frozen embryo?
Okay. Well, there's no reason why you can't go through the following month. So you do get some people who have a failed implantation and they go through with the next cycle. But you get some people that actually, to try and recover from the whole experience, it's not just physical but psychological as well, may like or may need, just a month or two just to fully recover before they embark on a frozen embryo. But as far as I know, there's no physiological reason why you couldn't just continue with your treatment. That's again something that your clinician would advise you on. And I know that some centres may have different protocols. Some centres may insist that you do wait 1 or 2 months. But again, as far as I know, there isn't a physiological reason why you would need to do that.
Understood perfectly. Once again, thank you so much for yet another question and, of course, for your thorough answer. And there's a thank you from Maria for you as well. And it seems that that might be our last question for today. But of course, remember that if you have any left, you can still go ahead and type them in, or you can simply get in touch with Karen and her team using the link I have just sent to you. There is an option to contact the team, so go ahead and do it. If you would like to get more details and the question for you, Karen, is right here. Do thawing embryos from day 3, 4, 5, 6 have the same success rate?
Okay, so in my presentation, I did mention that over the years, the survival rates have improved greatly when we introduced vitrification of the blastocyst stage, which is stage 5 and 6. So those embryos do have a better survival rate over the day 3s and 4s, and that has been shown. It's quite rare for people to freeze on day 3 and day 4 nowadays, and the earlier stage, which is day 1 at the just fertilized stage. So between day 5 and day 6, well, the protocols are normally you want your blastocyst to be a fully expanded blastocyst like the ones I've been showing you on day 5. And you give yourself the extra day, which is day 6, to give the blastocyst the benefit of the doubt, just in case it's just a little bit slow, it just needs a bit longer. So the survival rates of day 5 are actually higher than day 6. And I'm sure there are some programs that say that they have no differences, but you know, when I've been looking at the survival rates, which are up in the 90s, we're finding that the survival rates and the best chance of pregnancy would be from a day 5, but you do still get a pregnancy from a day 6 embryo, which is why we do leave them until day 6. And again, we also have the quality to take into consideration as well. It may just be that the embryo was just a little bit slow, and it was a really good quality by day 6.
Wonderful. Thank you so much for yet another explanation, of course, to this interesting question. And before I let you go, there is one more question that has shown right here. Okay, so I guess we can still answer that. So it is, if they freeze Embers buy solution from one company, and when they come to thaw it, doesn't find same company and thaw it by other company solution? Does this affect the Ambrose? I guess. Sorry.
Yeah. So in theory, no, it shouldn't. But we are never 100% about the recipe from different companies for their freeze thawing solution. And the safest thing would be to go by the manufacturer's recommendation. So if an embryo was coming to our centre that had been frozen somewhere else in, let's say, solution A, and we use solution B, we would buy the thawing solution that is specific to the embryos to continue with the treatment. We wouldn't use our own solutions of choice because we follow the manufacturer's recommendations to make sure that if it goes wrong and it turns out that you've used completely different solutions to what it had been used to freeze them, I feel that could leave you open. So my advice from my experience would be to thaw them in the thawing solution that the manufacturers recommend that you use.
And once again, thank you so much for answering yet another question. And yes, that was our final question for today. So thank you so much, everyone, for all of your questions. Definitely interesting ones, and definitely different ones as well. So, Karen, you had lots of work to do today. So,
Yeah,
I
I
hope
should
you
have put
are
more
happy
slides in, but
with.
it's been very enjoyable. Thank you for having me.
Thank you so much for joining. It's been a pleasure to have you indeed. You are just another team member of RAG, so I'm very, very happy to have you here as well. And I believe it went very, very well. And of course, there are some thank yous coming up your way. Thank you very much. And of course, there's a thanks right
Thank you.
here
Thank you.
and here. And well, I want to thank everyone and each of you for joining us tonight for your interesting questions. You never disappoint. There are plenty of questions that you always put here, and we are very happy to answer all of them. And of course, Karen, thank you so much for your time, for joining our Stronger Together initiative. It's been a pleasure to have you here. And of course, just let me remind everyone that this has been recorded. So, of course, as well, it will be uploaded on our platform, myivfss.com, and of course on our YouTube channel. It will be available tomorrow. You will be able to watch this. And as you know, we will be back here tomorrow at 8 p.m. UK time. So I hope to see you there. And Karen, is there anything else you would like to add?
No, not at this stage. I'd just like to thank everyone. They were, for attending, but also there's been some really good questions. So thank you. I hope I've answered them. If not, get in touch, as Caroline has said. So thank you very much.
Of course, feel free to get in touch with Karen and her team, and they will definitely get back to you. And you can see the link in the chat section. But when we finish, of course, you will be redirected to the team as well. So you can go ahead and use that link as well. And of course, once more, thank you so much, everyone, for joining, for your questions. It's been an interesting session. So huge thanks for that. And of course, everyone, have a lovely evening or day wherever you are. Thanks so much. Take care and see you soon as well. Karen, thank you so much as well. Bye.
Bye. Bye.